Hey guys, it's Casey. I am here once again with Dr. Ted Eisenberg, Philly's #1 cosmetic breast surgeon. It's good to see you again.
Pleasure to be here.
And of course we chose you to be our expert because you have, this is overwhelming, performed on over 4,000 women. That's like such a feat. I can't wait to come in and talk about breast lifts with you. That's what we're going to talk about today. Last time we spoke about breast augmentation. Let's get into breast lifts right now.
Okay.
What are some reasons women might need a breast lift?
I would say the two most common reasons, Casey, would be pregnancy or weight change. With pregnancy, a woman's breasts fill with milk and the milk actually stretches the skin,
Okay.
causing some droopiness. When the milk disappears, the breast could be either a similar size, bigger, smaller, and oftentimes droopier. And weight change does a similar thing.
So should women opt not to breastfeed? Does breastfeeding make it worse?
Actually, breastfeeding has nothing to do with it. It's really mostly a function of the milk coming into the breast and stretching the skin.
Okay, what about exercise? Women ask, can I just do a certain form of exercise to maybe just enhance the lift of my breast and not go through, a procedure? What's up with that?
Well, exercise is a good thing, but unfortunately, it's really not going to help lift the breast because the breast is a breast gland surrounded by skin and there's no muscle there.
There's no muscle to build.
Right.
Okay, good point. How can you tell if a woman is a good candidate for a breast lift?
Well, one simple test would be what we call the pencil test. A woman can do this at home. If she stands in front of a mirror and puts a pencil underneath the breast, in the crease underneath the breast, and she looks in the mirror and sees whether or not the nipple is below the pencil or above the pencil. If it's below the pencil, then she's a candidate for a breast lift.
Okay, I'm trying to picture it right now in the mirror. I'm maybe I don't think I'm quite there just yet, but we might get a head start on the lift for me. So, do most women just need a lift, or can you get implants too? Do you do it at the same time? How does that work?
That's a very common question. Women aren't sure whether they need a lift, an augmentation, and basically we tell women not to worry about it. Come on in for consultation. With my extensive experience and the pictures that we show, I can help a woman figure it out. One of the things I might do when a woman's in the examination room is I would ask her when she's home in her bra and looking in a mirror, does she have the thought, I wish my breasts were bigger? If that's the answer, if she says yes, then she needs a breast augmentation as well.
Okay, so just putting the implant in, that wouldn't lift up the breasts?
No, actually a breast augmentation, the implant only makes you bigger, doesn't do any lifting.
Okay, now how does the actual lifting procedure work?
Well, the purpose of the lifting is to give a perkier, possibly pre-pregnancy look, and that would be by lifting the nipple, sewing the nipple higher. I don't remove the nipple, just sewing it higher, and tightening some of the stretched skin.
Okay.
To make a new bra or brassiere of your own skin to give you more support for that perky look.
Now after that procedure, what is the recovery like?
Recovery is actually fairly quick and very manageable. For example, 90% of my patients tell me they're back to work in the office in 5 days. So if a patient has a surgery Wednesday, they're back Monday.
Sounds good. Sounds quick and easy. Do any women usually need a second or third lift?
Well, good question. Kind of like how we started the conversation, the two things that can change the shape of your breast, pregnancy and weight change,
Right.
can also change the result of the surgery. So if a woman's going to become pregnant again, her breast could fill with milk, get stretched again, and she might become droopy. Same with weight change.
Okay, so then do you recommend that if she's planning to have children, she waits on the breast lift?
No, not necessarily. It's a very personal decision. I would advise a woman, if she's thinking of having a child within a year's time,
Okay.
then she should probably wait. But if she doesn't know when she's going to have a child, or that's some thought for the future, I would say if she wants to enjoy perkier, lovelier, perkier breasts now, she should go ahead and have the surgery now.
Sounds good. Now, where can someone get more information about breast lifts or, just your facilities?
Well, you can always call, a patient can always call my office at 1-888-SHAPE-12, or come to our office for consultation, which is free, at 2375 Woodward Street in Northeast Philadelphia, the close Northeast. Or you can get all of that information really on my website, which is www.lookingnatural.com.
Lookingnatural.com. Great. Thank you so much.
That's the goal. My pleasure.
And I'll
Casey.
be coming in to see you about that possible breast lift.
All right, thank you. Thanks for having me.